This is a draw and give class, and today we will go over how to give an injection. We highly recommend that you get your injection here in our clinic through a professional in our clinic, but at the same time you may opt to have a trained individual, such as a friend, spouse, or nurse that you know that may be able to be trained to administer your shots from the house. In the interest of your safety, we highly recommend and stress the fact that you may not administer your own shots. This video will show you how to give a subcutaneous injection. Now follow along with your printed label. The label says that it is a subcutaneous injections. Subcutaneous injection is administered in the deeper layer of the skin. We call it the subcutaneous tissue, and it's done on the upper arm or thigh. If you are receiving several injections, it is better to have one injection on each arm. So if you have 2 injections, which is most of the time the case, you do 1 injection on each arm. In children, it is better to alternate from arms to legs for each injection. Refer to the packet labeled allergy injection dosing record. You can use this dosing record to keep track of your injections. The record will show that you'll be getting 2 injections or 2 shots, one on the left arm and one on the right arm, or one on the right thigh and one on the left thigh. However, you can combine the serum. Even though you see 4 vials, you combine vial number 1 with vial number 3 and vial number 2 with number 4. Each injection is going to be 0.1 ml. In order to extract the serum from the syringe, it is important to first place the vial that contains the serum on a flat surface. Take as much as you can to reach the 0.05. If it goes above the 0.05, that's okay. You can take more and then push back in until you reach the 0.05 mark. And now you have 0.05 ml of the serum. It is important to remember that there is a big difference between 0.05 and 0.5. Remember that 0.5 is almost half the needle. 0.05 is a very small amount. From the second vial now, do the same thing and withdraw 0.05 ml. Again, you can withdraw a little bit more and then inject. And now, with the combination of the two, you have 0.1 ml serum in the syringe. Be sure to wash your hands before administering an injection. Then you want to clean the injection site with an antiseptic pad, such as alcohol or something similar, using a circular motion. Now we're going to show you how to give the injection. You can remove the needle guard and be sure not to touch the needle. It's very important to keep it sterile. Now you're ready to give the injection. You pinch the tissue in the upper arm around the mid-deltoid or upper thigh between your thumb and your index finger. It is important that when you insert the needle, you are doing it at 45 degrees angle. Release the pinched skin after you insert the needle, and this will stabilize the needle in its place. Do not give the injection right away. First, you have to make sure that there is no blood. In other words, you need to make sure that you have not hit a blood vessel. So you try to pull back on the plunger. Make sure no blood is going back into the syringe. If you see blood coming back into the syringe, the most important thing to do now is to withdraw the syringe and the needle together and discard it. You have to pull it out at a 90 degrees angle. And it is important that you switch the needle and you have a clean needle and a clean syringe to ensure sterility. This time, if there is no blood coming out, make sure that you press the plunger with your free hand and then slowly inject. Do not inject quickly. Rapid injections may put pressure on the tissue and can cause pain. Once the injection is finished, you are going to withdraw the needle quickly from the injection site at the same 45 degrees angle in which it was in. It is important after you do that you place a pad on the injection site. Next, what you need to do is massage the injection site very gently and use a sterile pad for that. Gentle pressure applied to the injection site will help seal the puncture area and make sure that there is no fluid or any type of serum or blood coming out. It is important that you have somebody with you at all times for at least 20 minutes. During those 20 minutes, you can do whatever you want as long as the other person is watching you. If you get a serious reaction, which we refer to as anaphylaxis, you need to make sure that that person is going to take care of you and be ready to give you epinephrine, or what we refer to sometimes as EpiPen. Please make sure that you are familiarizing yourself with the use of the EpiPen. If you have to use the EpiPen for serious or severe emergencies like this, it is important to use it and to call 911. Allergy Arts is also always happy to help in any way. Here are some helpful tips for you for administering the injections at home.
Take an antihistamine on the day of your allergy shot. Avoid dusting your home or yard work on the day you receive your allergy shot. Serum must be refrigerated. Do not freeze the serum or leave it out for more than 48 hours at room temperature, or it will spoil and need to be thrown away. Pay attention to the expiration dates on the serum and EpiPens. It's your responsibility to fill out an EVO form when your serum needs to be remixed. Please allow 7 to 10 business days after we have received the form to receive your serum. It's important that you are watched for 20 minutes after a dose and that you keep an epinephrine pen with you at all times.
This concludes our Draw and Give class. If you have any more questions, a nurse is going to come and revisit with you about all the steps that we discussed and answer any other questions that you may have. Our staff at Allergy Arts is happy to answer any questions and help you in any way to make your life better and improve on your quality of life.